How long have you been a diabetic?
About 5, 6, 7 years.
Okay. And so tell me, like, what was treatment like during those 5 or 6 or 7 years?
I started out on a very low dose of an oral anti-hypoglycemic and went higher. Um, and after a long time, that was metformin, I remember. See, I can't remember what happened. They had to be taken off of metformin. Something happened medically. And then I was on other oral hypoglycemics. About 3 years ago, um, about 3 years ago, I also have COPD. So about 3 years ago, I became very ill with respiratory problems and could not get better. And so they had to use. I had to take prednisone, which finally got the COPD under control. During the course of the prednisone, my blood sugar was sky high. And that was probably a second or third time that had happened, because I also have other medical conditions that go hand in hand. So that was about the third time since I was on a diabetic that I got the respiratory problems. So the third time I was on the prednisone. And so my blood sugar always went up, but it came down after I was off of the prednisone. Well, this last time it didn't, and I had to go on insulin. Started off with a long-acting Levemir and 3 or 4 units, and of course nothing helped. Then I had to go on increase the long-acting and start a short-acting one, that Novolog, and that's what I've been on since. My blood sugar over the course of 3 years has gotten worse. I gained a lot of weight. And my blood sugars, the insulin, I just kept increasing the insulin until when I came here, I was on the Levemir, which is a long-acting. It's a flex pen, and all it holds is 60 units. I injected that every morning, 60 units, and that to hold me over the day. And I also injected the short-acting, the Novolog, and I was up to 10 units 3 times a day, and just to try to keep the blood sugar down. So I kind of knew where I was heading. That's why I came here.
So you've been under care with Dr. Steph for about a month? Maybe a little longer?
Not even that. I think we started January 3rd or something, right after the...
Okay. So tell me what you've noticed since then.
Oh, wow. I've lost about 10 pounds, and I'm off of my blood pressure medicine totally. And so far, knock wood, my blood pressure's fine. Now, I was on that for years and years. And in fact, there was about 6 or 7 years, about 5 years ago, my blood pressure went out of control. The doctors could not control it, and I was on 5 blood pressure medications. And still, finally, that got under control. And but I was on this one medication for a long, long time. I'm off of that. So I'm off of all of my blood pressure medicine, and I'm off of all of my short-acting insulin, and I'm in the process of decreasing my long-acting insulin. I went from 60 units to 55 to 50. Now I took 45 this morning, and I have to watch for low blood sugars every night. I think this morning my blood sugar was low, so
That's great.
on the way to work after the insulin. Yeah,
So what have you noticed? What's the difference between the treatment that you've gotten with Dr. Steph versus the treatment you've gotten in the past?
one of the things that struck me that she said when we were talking, and which was what I knew all along, and I was looking for all along. What we get is standard treatment, not individualized. And my lifestyle is such, I don't know, from time to time, so I'm not a stay-at-home person, so I can't just have my life structured that way. And that would have worked, I think, if I did. Nothing else would have worked. I was looking for the individualization that she has done.